This is HealthCall Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the HealthCall Radio Hour, now available to stations across the country through national syndication. We're going to focus today on a situation that faces far too many people. It's a condition that you may not even know you have, but can dramatically change your life, and that is chronic kidney disease and management of that disease. 1 in 7 Americans are thought to have some form of kidney disease. End-stage disease is going to lead you into dialysis and eventually kidney transplant if you can get there in time. So we want to talk today to a company that claims to be revolutionizing management of kidney disease. We're going to do that by talking to Patrick Covington. He is the Director of Provider Engagement for a company called Somatus, serving over 150,000 patients in states across the country. Patrick, glad you're here. I'm eager to learn more about all of this, but let's get started with your story. You're a registered nurse. What led you to this concern and interest in kidney care?
Thank you, Lee. Thanks for having me. My interest was personal first and then professional. I've been a registered nurse for 27 years. I've been in the care management space for about 13 years, working with patients with all chronic diseases. The personal aspect was a best friend that I had who was struggling with end-stage renal disease. He lost his life right prior to my joining Somatus. His goal was to make it to his 55th birthday, and he expired 1 month prior to. So our last conversation was, you'd be a perfect fit for this role. And, I just want to see you go out there and help many patients like myself. So here I am.
Wow, that's a personal calling. That's great. So kidney disease is, I think, the 9th leading cause of death in the United States. So a serious problem. And as I said, millions of people are in that process and don't have any idea. The symptoms are so vague. Tell me about when I get involved in management, where does it typically fall short? What are people missing out on that you hope to provide?
First is creating that awareness, Lee. We aim to capture patients further upstream. When you know that you have kidney disease, many times it may be too late. You may be in stage 4 or 5, and you start to manifest symptoms. You have the aches, the pains, the swelling, things that, your body is going through so many changes, you don't know what's happening. But those that are further upstream, where they're, not paying attention to some of those underlying symptoms, those are the ones we want to capture. We want to speak to everyone, but education is the first step to create awareness.
Great. So tell me about that. What is it that I need to know? If I'm newly diagnosed or I'm curious about those symptoms, what do I need to be doing?
First thing is your diet. Are you on the proper diet? Are you making sure that, you're not drinking too much carbonated beverages? Your fluid intake, is that regulated? The sodium intake into your diet. Are you following the medications that are prescribed by your physician? And with some of those medications, if they're not taken on a regular basis, then they can cause further complications and difficulty. And then making sure that you are following up with your physician on a regular basis, because compliance is a big issue too. No one wants to take a medication for the rest of their life. No one wants to adhere to a diet, because diets are, they come and go, and it's hard to change habits. So it starts with that commitment that, I want to feel better, and I want to preserve my quality of life and stay at home.
So your program does what in those regards? How do you help me stay effectively treating the disease once I'm diagnosed?
So Lee, how we help you is that we have a team of clinicians that are in the community. So with every patient that is assigned to our program, they have a RN care manager, which we call the quarterback of the team. So that's someone that's going to call on you monthly, check in with you. How are you doing? To make sure that, that there's clarity. Because sometimes you can go to your physician and you have this long list, but then there may be some confusion. Do I take this in the morning, take it in the afternoon? So your RN care manager, that's your coach, that's your quarterback. And then we have a patient health advocate who would actually come to your home and they may call on you and check on you on a regular basis. There's a renal dietitian. That renal dietitian is the one that's going to help you with that adherence to your nutritional needs and any questions that you may have. There's things that I didn't know before I joined Somatus, as to what fruits I can take and what I can't take if I have chronic kidney disease. There is a PharmD, so we have a pharmacist that's in the field, and they will check in with you on a quarterly basis to make sure that the medications you're prescribed are kidney friendly. We don't want you to have medications that are toxic to your kidneys. And those could be medications that are prescribed from your primary care physician, and maybe they weren't communicated to the nephrologist, so the two are connected that way. And then lastly, we have a social worker. For the populations that we serve, sometimes they have barriers such as transportation needs, and those transportation needs override my medication and my health needs.
Sure, I get that. If it's a struggle for me to get to care, obviously the quality of that care is going to slip.
That's
What
correct.
What do we know about the effectiveness? If I enroll in your program, what is my outcome versus people who might self-manage?
The stats that I don't have right in front of me, so I do apologize for that. But I will say that when you look at a patient, and we look at them from being engaged or not engaged. So someone who doesn't have those wraparound services with them, they're battling that complex healthcare system by themselves. So there is a high propensity to be non-compliant, to be frustrated, and there's probably a 7 out of 10 chance that you will have to go to the emergency room because your symptoms have overwhelmed you, and hopefully you won't have to go to the hospital, because if it's that complex, then you would have to go to the hospital because your symptoms can't be managed. Versus someone who is engaged and managed, there's that frequent touch, those frequent phone calls or conversations that take place. You know who to call when you have an emergency. You can call after hours and speak to someone. And so those preventive measures will keep you out of the emergency room and out of the hospital. So the success rate is fairly high for those that have that team approach.
Tell me about, for those who don't know about kidney disease, and frankly, I'm on that list. My knowledge is not very deep. So what would drive me to the hospital in that crash and burn scenario that's going to cause me to have that crisis event?
So with kidney disease, kidney disease in itself is attached to other comorbidities. So underlyingly, that person may have high blood pressure. They may have coronary artery disease or some type of cardiovascular disease underlyingly. And when those symptoms manifest, you have the high blood pressure, you have swelling, you have pain, shortness of breath. So you have all these complex symptoms, occurring at one time. And as you get further along in the premise of your kidneys, what they do, the biology of them or the anatomy physiology of them is they cleanse the body of toxins. So they cleanse your blood. So if they struggle with that, if there's a chronic event where they've been damaged and they struggle with cleansing the body, then that kind of builds up in your body. And that is what causes those symptoms underlyingly. And you feel horrible. It may be something simple as the swelling of the feet and just overall malaise and fatigue. So once those symptoms hit, then you need to be seen medically.
Got it. Who pays for this service? Is this something that I, as the patient, am out of pocket on? Is this covered by my insurance? Is it covered by Medicare? How does all of that work?
So our services are, you can say, free to the patient. The patient doesn't pay any out-of-cost fees for our services. We are partnered with every major health plan, Medicare, Medicaid, and private insurance. So it's an added benefit for the insurance that you already have, Lee, or for those out there, those consumers.
So if I am already in treatment and nobody's talked to me about this type of service, what's my first step? What do I do about that?
Your first step would be to talk with your primary care physician, because typically, everyone has a primary care physician
Sure.
attached to them. And if you're a nephrologist, your kidney doctor is the one taking the lead. Talk to them about care management services. Most patients they're seeing, when they go out into the community, they struggle because they need some extra services to help them with those transportation needs or those assistive those social economic needs. And so care management is the start.
And should I just expect that my nephrologist is going to make this suggestion? Is this going to happen every time with every patient, or are people slipping through the cracks?
Well, that's a great question. Our company, and there's others, but our company, the way we're changing the narrative is that we're educating everyone. So it's not just the patients that require education. It's also those thought leaders, such as those clinicians, to know, who our program is, what we do, what we can provide, and the partnerships that we develop. And that's my role as a director of provider engagement. I meet with those thought leaders, on a daily basis to partner with them, to educate them, to align with them, so that they see we are an extension of them, not a replacement, but an extension to the excellent care they provide already for all patients that struggle with kidney disease.
Got it. Tell me about the experience that I'm going to have as a kidney patient. So you mentioned transportation, dietary counseling, all those types of things. Am I going to have to reach out and request that, or is the idea here that you're going to actively recommend and touch those patients and try to encourage them to take advantage of this?
Yes. So for every patient that is assigned to us and that is under our care, we have a comprehensive team, like I explained earlier, that's their team. Everyone has a comprehensive team. And so each team member, each clinician on that team, they have a specific role, a duty to carry out with that patient. So we're going to provide a thorough assessment of the initial needs upon entry into the program. And then throughout, we'll make those adjustments because needs change as the patient moves through the program. They may be more complex as you progress along, or they may be not as complex because your health is stabilized. So it's a case-by-case scenario, but everyone has that availability for those comprehensive wraparound services that we provide.
So I want to just get down to the bottom line. Are you going to be nagging me? In a positive way, encouraging way, but is the idea here that you're going to stay after me and make sure that I try to maintain health? What do you do in patients who just either are resistant or don't care? Those guys are out there, right?
They are. There are patients out there that are resistant. Nagging, that's a good verbiage. Let's say more health coach.
Okay.
With
You're going to
our
be an
program,
insistent health
yeah,
coach. All right.
with a
Yeah.
persistent health coach. With our program,
Okay.
we are actually in the field. So sometimes a telephone call may not be enough, Lee. Sometimes you may need someone to make a knock at your door and say, "Hey, I'm here with my badge," and just that knock at the door, that means a lot in 2023 because you don't see that.
Hmm. Yeah, it's
Normally
true.
everything is remote, everything is telephonic, but we actually go out there and meet the patient where they are. And there's just a high percentage of patients that they like that, they need that, they like those
Mm-hmm.
extra touches.
Mm-hmm.
If a patient feels as though they're at a point where that may be too much, then we can scale it back accordingly. But we'll never let them fall off the radar because that is what's causing the current situation we're in now is patients being lost to care. And then they end up in the emergency room or the hospital.
Yeah, and if the disease progresses to the state where dialysis is necessary, that's a huge burden on everybody, including all of us. The Medicare system pays thousands of dollars a year to support those patients. So I see how being active and keeping people healthy is an advantage to all of us who contribute to the cost of healthcare in the country. That makes a lot of sense. So if I am concerned and nobody has suggested any type of care, either you or another company, what is my first step? What do I need to be doing?
If no one has reached out to you, the first step is letting your clinician know that I need comprehensive care management. I want to have a health coach. I heard of this great company. I want to go ahead and be a part of that. If the physician, if you find that you're not getting help in that avenue, then you can reach out to your health plan and let your health plan know.
Got it.
Or you can
Okay.
reach out to us directly, and then we can also help you too at Somatus.
Well, I appreciate your time. It was interesting to learn about this process. And I think there are probably people out there who are headed down this path and don't know that services like these are available. So I hope maybe we've covered that today. Patrick, appreciate you being here.
Thank you, Lee. Thanks for having me.